So today we're going to talk about frown lines. These highly visible lines can make you feel angry or worried, even if you really don't feel that way. Are they caused by too much worrying or frowning, or is there another cause? Well, Dr. Robert Langdon is the medical director of the Langdon Center and is back to talk all about a new procedure called NoFrown. I like the sound of that, doctor. Welcome to the show.
Thanks.
First off, let's start off. Why do people get those frown lines?
The frown lines are caused by contraction of the frown muscle. So the main frown muscle causes the eyebrows to pull together. And when that happens, it creates these vertical lines. So we have, for many years now, been doing botulinum toxin injections, which are a reliable way to relax the frown lines. So this would include Botox and Xeomin and Dysport, and I do my own, in fact, my own Botox. So if I try to frown like this, you don't see much action. You don't see.
I'm not going to
lines.
do it because you could see mine.
But the main drawback of these botulinum toxin injections is that they are pretty temporary. They will wear off usually in 3 or 4 months, and then you have to do the treatments again. You have to repeat them.
So the big benefit to NoFrown is that it would last longer.
Right, yeah, so the injections, the botulinum toxin injections, they work by deactivating nerve endings. So it's right where the nerve interfaces with the muscle. And unfortunately, what happens though, within 3 or 4 months, is that the nerve cells will produce brand new nerve endings to take the place of those deactivated ones. So with NoFrown, the concept is to just go back a little farther on the nerve and actually disable the nerve.
Okay.
And that can be done in different ways, either by kind of cutting through the nerve, or we now use a radio frequency, like a little electrode that goes right to where the nerve is and will heat it up and deactivate it.
Okay, well, let's take a look at some pictures and you could describe what we're looking at.
So this is a patient who is basically frowning really hard, and she has those vertical lines in between the eyebrows in the frown line area, and she's frowning so hard that she even has the muscles around the eye are very wrinkled. And this is how anybody would look if they had never had any kind of treatment.
All right, and then, oh wow, that is dramatically different.
So this is the same patient a month or so later after she had the no-frown technique, and basically she's trying to frown as hard as she can. You can still see the wrinkly skin around the eyelids. However, those lines, those vertical lines between the eyebrows are gone. So this is what you would see typically with botulinum toxin, Botox injections, and we're just creating that same effect, but doing it in a way that we expect it to have a much longer lasting effect.
Okay, is this a painful procedure?
We require a little bit of local anesthetic for numbing, so once it's numb, it's painless. The procedure itself is not felt.
And now, is this something you could do with surgery?
You can. There are surgeries such as brow lift, which I do, for example, endoscopic brow lift. And part of that procedure is to accomplish the same thing with the nerve, making little snips through it. And of course, we get other benefits such as the lifting of the brow. But for this component, this simple concept of just deactivating the nerve, it can be done in a very minimally invasive manner with no stitches, little, if scarring. Usually we expect no scarring at all, just because we're doing it through the surface.
Okay, so obviously there's less recovery time too compared to a surgery.
Right. Yeah. So you know, if there's maybe a little bit of swelling, most of the time we can minimize any bruising, and the recovery can be very quick.
And now, doctor, besides the cosmetic improvement, are there psychological benefits, would you say, to reducing these lines?
Yes, it's very interesting. In fact, just in the last couple of months, a book has been published. It was written by a dermatologist, and I saw the review in the New York Times. And there is a major, there's been a lot of research now about the psychology of frowning, and it's even now used to treat depression. So people who have major depression, a significant percentage of them, if they have improvement in the frown lines, they actually recover from the depression, so they don't need medications. And also there's a lot of psychological interaction when someone is frowning a lot, it's a real downer. It makes the people who see them also feel bad.
Sure, I can see that.
And so there's a definite psychological benefit to making you look more like how you really feel, because
Sure.
you may not feel angry or
But your face does, right?
but your face does, and it doesn't reflect how you feel inside.
Okay, and Doctor, you have a free seminar coming up, don't you?
Yes, we have a seminar. It'll be Thursday, this evening, April 18th.
April 18th,
this
7
evening,
o'clock, right?
at our office, and usually we start at 7, and we will talk about NoFrown as well as lots of the other procedures that we do.
Sounds good. Let's put the information up on the screen. The Langdon Center for Laser and Cosmetic Surgery is located in Guilford. Just call the number 866-967-3855, or you could visit NoFrown.com. Thanks so much, Doctor.
Okay, thanks.
All right, up next, Chef Amanda Cushman shares a recipe for grilled fish when style returns. We'll be right back.